Good day and welcome to Conversations with AARP in the Virgin Islands. I'm Troy Deshabir-Schuster, State Director of AARP in this territory, and once again, it's a pleasure being with you. AARP is constantly working with collaborators and other organizations to educate and provide information to our members and communities about issues important to them. As we work to ensure that people age with respect and dignity, we join efforts with organizations to provide tools and resources for them to find more health, wealth, and happiness. March is National Colorectal Awareness Month. According to the American Cancer Society, colon cancer is the third most commonly diagnosed cancer and the third leading cause of cancer death in both men and women. In 2020, there were an estimated 104,000 new cases of colon cancer and 43,000 cases of rectal cancer diagnosed in the United States. Colorectal cancer, which includes cancer in parts of the large intestine, takes an incredibly steep toll on African Americans, who are 20% more likely than whites to be diagnosed with the disease. Colon cancer is the most preventable, and there are ways to test to ensure you remain cancer-free. And so today, we observe Colorectal Cancer Awareness Month. We have with us Dr. Lillian Santos, Executive Vice President of the American Cancer Society in Puerto Rico, and Dr. Raymond Cintron, gastroenterologist on the island of St. Croix. They will share with us the services of the American Cancer Society and speak about prevention, screenings, and other resources. Welcome, Dr. Lillian Santos and Dr. Raymond Cintron.
Hi, nice being with you today.
Hi, good day.
Likewise.
Happy to be in this important meeting today.
Thank you. Thank you for joining us to share with us important information about colorectal cancer. And so, Dr. Santos, tell us about your role in the American Cancer Society in Puerto Rico.
Well, as Executive Vice President for Puerto Rico and also supporting the Virgin Islands, I've been having the privilege of leading the organization for the last 26 years, an organization that's committed to save lives, our mission of saving lives, but we cannot do that without our volunteers, our constituents, our donors, and our alliances with people like you, because through public education and through focusing on the community at whole, it's more cost effective. It will be saving more lives if we promote screening and early detection through screening and also prevention. And one of the most important things the American Cancer Society wants to do is to provide access to service. That is why in our commitment in the U.S. Virgin Islands, we have granted Dr. Cintron with some resources to provide. Nobody has an excuse not to be able to do testing in a timely manner. So that's why we gave this grant for uninsured and underserved population. We know that our guidelines change from 50 years to now to 45 years. You should be doing your colonoscopy if you don't have a history or symptoms. So right now, I think we're talking to your audience, the right people, that we need to be committed to our health and make it a priority, because anything early detected could save lives and increase survivorship.
Great. And so am I understanding correctly that the American Cancer Society has provided funding here in the Virgin Islands
Yes.
For colorectal cancer screening?
Yes. And we're doing it right now through Dr. Cintron. And we're providing access to a service that maybe some people don't have. And they need to make sure to call us and access these services and visit Dr. Cintron in St. Croix to make sure that you could early detect anything. And screening is very, very important, especially if you're at age 45, and if you have a history of cancer in your family, you should be asking your doctor earlier to do your colonoscopy.
Great. And Dr. Cintron, tell us about the various types of screening for colorectal cancer.
Hi, good morning. There's many screenings available, and Actually, there are more research now in order to develop even more screening possibilities to accommodate different patients. Um, they might start as simple as a stool test that will check if you have alcohol blood. Okay. There's other type of stool tests that will check out some DNA that the lesion is going to shed in the stool. Uh, they are simple. They only require stool samples. They have certain limitations that we cannot discuss now, but it is for you to discuss with your physician. And you can actually have a virtual colonoscopy, which is done in a radiology office. You can also have what I do, like colonoscopies or flexible sigmoidoscopies. Uh, the advantage is that, I'm probably biased for it, but the advantage is that if you do have any of the other screening tests and they're positive, then you end up requiring to have a colonoscopy anyways. Uh, Once I do the colonoscopy, I have the opportunity that if I see a lesion, then I can remove the lesion on spot. Okay. Uh, but it is extremely important for people to know that there's few different options to do their screening, and they should be inquiring in their physicians about when if they're available for screening. Anyways, right now, as Lillian said, all the insurances actually do the provision of colon cancer screening without any copay. Actually, that's part of all the insurances, including MAP. There are some unfortunate patients, for whatever reasons, they don't even qualify for the MAP. And in 2021, we had our first grant to do some of those patients. We did a small number, and it was a very, very successful. So now we are going to do it at a bigger scale. So people can actually have their colon screening. If you actually don't need to have a referral, even though I always encourage you to discuss it with your physician, but if you're 45 years or older, just because of the age alone, you already qualify to have it, to have any of the screening tests that we have available.
Okay, now
It
you
is important.
mentioned, go ahead.
Sorry. It's important to define that what is colon screening is in somebody who do not have any symptoms, uh, and don't have any family history of colon polyps or colon cancer. Those are what we call average risks. They actually can get any type of screening available. But if the patients have his family history of colon cancer, or if they have had colon polyps before, or if they suffer from Crohn's or colitis, or if they have any symptoms like bleeding, something so simple like bleeding, then that's not a screening anymore. They're already having symptoms. And that's what we want. We don't want to wait until symptoms occur, because I will tell you in my experience, most of the cancers that I found, patients are taken by surprise. They don't have any symptoms. So symptoms are not reliable. You have to do it just because of the age.
Now, you mentioned, Dr. Cintron, colonoscopy and also flexible sigmoidoscopy. Can you explain the difference between those two?
The difference between those two is they both involve the cleansing of the colon, and they put in a TV, the scope, which is basically a TV camera that we put on inside the patients under sedation. The flexible sigmoidoscopy is limited to the left side of the colon, while the colonoscopy, we check the complete colon. Okay. Sometimes, as gastroenterologists, we do a limited one depending on the age. However, my experience here, unfortunately, I have found tumors in people in their 20s. So I am not really following that many flexible sigmoidoscopies. If I am going to see and I'm going to check your colon, I might as well check it out completely, because I don't want to miss any lesions.
Great. And so if somebody is interested in getting a colonoscopy, having a colonoscopy done, how do they arrange for that?
Well, in In my office, I have what usually is also done in the States. We have what's called an open access colonoscopy, which is making it easier for the patients, that you don't require to have a referral. It was shown that just the need for you to go to your primary doctor and request a referral was a little hurdle for certain patients. They did that also with the mammography. So if you have the age and you want to be screened, you can just there's a website in my office, so you can go to the office, fill out. Now, we all about patient safety. So if there are patients who need to have their colon cancer screening and they don't have any comorbidities that will put them at risk, we go ahead and schedule them right away. If there are patients who have comorbidities, like a lot of our patients have, like that could be a risk, then they need to be evaluated first in order to manage those comorbidities and get them controlled. And then when we do the procedure, we have the least possibility of having any complications. But it's open access. You just call, get it screened, and it's scheduled. In the States, because of the COVID, there's a many months worth waiting list, because multiple hospitals stop doing elective cases. We're still doing some, but there's a backlog. And unfortunately, what that did is that some of the patients turned from elective to emergency because they had lesions that could have been removed, and because it was not done on time. And then now they're not elective. Now they have a problem. But now we're going back into the regular function. So we get them done.
As a matter of fact, Troy, I wanted to comment on that. One of the biggest impact that COVID had over the community is the lack of screening during that time. And according to the National Health Institute, in 10 years, the mortality rate because of cancer, unfortunately, is going to increase because people stop doing their screenings. Not only the colonoscopy, also mammographies. So today, we are celebrating Colon Cancer Awareness Month, and I don't want to speak about awareness. I really want to do a call to action. We need to put it in our agenda. We need to access Dr. Cintron's office. Last year, we gave a grant of over $17,000, and we did have 23 patients. This year, we want to take care of over 40 patients to see if we could really give them the means to do it. We understand the backlog, but please be patient. It's important to take care of your of your health. The American Cancer Society is present in the USVI, providing not only access to services to people with not that they don't have cancer, but for cancer patients. Also, we're here to provide financial assistance, support groups. If you need to travel to Puerto Rico, we have a Hope Lodge. A Hope Lodge is the only free, it's a hotel where you could stay the patient with your caregiver while you're in chemotherapy, radiotherapy in San Juan. So this is a service that the American Cancer Society also provides for you. So it's important for them to know that we are here to help. Our number is 1-800-ACS-2345. I repeat, 1-800-227-2345, or you could access our webpage, is www.cancer.org. We are here for people with and without cancer. So important. It's not awareness month. It's call to action month. Put it in your agenda. Call Dr. Cintron's office. Make sure you do this colonoscopy on time. If you're 45 or more, or if you have a history and you have any symptoms, any early detection saves lives. And the American Cancer Society is committed to do so. So I really want to thank Dr. Cintron for this collaboration. We've been granting this fund since last year, and I'm looking forward that we could continue to do this, because there's no reason. People deserve, in a timely manner, access to services. and have a decent health care, and no reason for not having a diagnosis on time.
You know, we've all heard about the American Cancer Society Relay for Life.
Yes.
We have those relays for life right here in the Virgin Islands.
Yes.
And it's so wonderful to know that the monies that are being raised here in the Virgin Islands are helping people right here in the Virgin Islands. So I'm making a pitch for the Relay for Life.
Yes. A
Henceforth,
hundred
please.
percent.
Yeah.
Yeah. 100% of the money that you raise in the islands stays in the islands. So I want to take this opportunity to thank the volunteers that have been committed for so many years to support our Relay for Life, because Relay for Life, I always say a byproduct of Relay for Life is the funds, but the most important thing is that we're celebrating life. We are celebrating the life of the survivors in the islands, and they are a testimony that early detection saves their lives. So when we raise the monies, as that is because we're supporting the mission and we're providing access to service. And the money that we raise is not only, we always think that, oh, they're raising money for patients or their caregivers, and that doesn't have to do with me. So no, we're here committed to the whole community. We're providing access to screening, to a colonoscopy in a timely manner, to mammographies, because we also give grant to the Juan Luis Hospital to do the mammograms during the month of October. So we added to that screening, we added the colonoscopy, because we know that the cancer registry in USVI, which I'm happy to share that you do have a cancer registry. You have data that is a reflection of what is happening in the islands. With data from 2016 says that in males, prostate cancer is number one, but colorectal is second, and blood and lymph nodes is third. And in female, breast is first, uterus is second, and colorectal is third. However, as we said at the beginning, colorectal cancer is the most preventable cancer. It has to do with good nutrition. It has to do with early detection. So we are today, once again, calling you to put it in your agenda. Call Dr. Cintron. If you don't have insurance, if you're underserved, please call, because there's no excuse this year to not having a colonoscopy on time.
You know, Dr. Cintron, as you and Dr. Santos already know, I'm proud to be a cancer survivor myself. And while I was going through the cancer treatment, I had many PET CT scans. And since chemotherapy, I've had many CT scans with and without contrast. Now, can either a PET CT or a CT scan with contrast show up colorectal cancer?
Well, the PET scan is not the ideal test to check out if you have colorectal cancer. It's more involved in staging, number one, and number two, as a follow-up to detect early recurrence. CT, the CT colonoscopy is with intracolonic contrast. It's not with intravenous contrast. What they do is they put some sort of contrast inside the colon, and it give you a double view, and then you're able to see the images like in visual, like we use now, and you see it. But the IV contrast that you have been exposed, unfortunately, no, it doesn't happen with it. No. But the
Okay.
PET scan is mostly for staging or early recurrence. Yeah.
Understood.
So we
Understood.
have to do some sort of the procedures that needs to be done, any of the screenings, in order to really detect. And as Lillian says, we are proud to collaborate with the American Cancer Society, because we have with the extensions that they did through Medicaid in our island. We have now a lot of more people under the Medicaid umbrella that will qualify for it, but unfortunately, there's still a percentage of the population that has no ways to have this done, and that's the group that we want to target, because usually those are the ones that, because they don't have the access to an insurance, they not only have they don't go and check their regular Medicaid problems. They also don't have the ability to get their mammograms and get their colonoscopies or pap smears. So it is important to detect it, because there's so many ways now, and we have new equipments, and the gastroenterologists who do colonoscopies are now need to be trained, because it's not just to do a colonoscopy. You have to have the technique, and you have to have the training to see and understand what you're doing through the procedure. Right now, they're emphasizing in not only major lesions, but small lesions that if you don't have the expertise, you're going to miss. So as they're doing more colonoscopies, they're requiring us actually to do more training about how to detect and how to new guidelines about how we are going to repeat the colonoscopy depending on the findings. So there actually is not just to do the colonoscopy, because anybody can do a colonoscopy. It's just for you to be the expert to see and know what to do with what you see.
Exactly, exactly. And I understand that there's also a new technique where one can swallow a capsule that has a camera in it, and as the capsule works its way through the gastrointestinal tract, you can see. Can you tell us a little more about that? And do we have that technology?
The initial purpose of that capsule was just to evaluate the small bowel, because when we do the colonoscopy, we can check any lesions in the colon. And when we do the upper endoscopy, we can look all the way to the first part of the small bowel. However, between how low we can go doing an endoscopy and how high we can go doing a colonoscopy, the small bowel is an approximately 12 to 15 feet. So there was no real scope to go there. So initially that capsule was done with enough power in the battery to be working for like 9-10 hours. But they said, why don't we do a longer lasting battery that not only checks the small bowel, but now checks the colon? So now they're doing that. It is still not in the official recommendations from the society, but it pretty soon will be, because actually you are going to be able to see. It's a little cumbersome because of the type of preparation you have to do in order for that colon to be completely clean and you'll be able to see. But still, I guess it will be eventually a good screening test. But obviously, if you do see any suspicious lesion, then you have to follow that with a colonoscopy to go in and remove it.
Right. And now, when it comes to setting up an appointment to have a colonoscopy done, for patients from St. Thomas, is this service also available with the grant from American Cancer Society? Can St. Thomas patients come over and receive that service here?
They can come over and do it here. To me, it has been a little more easier to do it in St. Croix, but I'm working with a center in St. Thomas to see how it can be done there too. Because we need to try to do it for as much people as possible. This is
we've been speaking. We've been speaking, Dr. Cintron, for the option of also extending it to St. Thomas. So we are looking forward to do it. It's not still completed, but yes, we want to provide these services also to St. Thomas.
And for the people from St. John, not to feel bad.
No,
when we said St. Thomas, we said St. Thomas, St. John.
St. Thomas, St. John, and Water Island.
And Water Island.
I wanted to mention something important that Dr. Cintron said about the funding of Medicaid. I want you to be proud that the American Cancer Society is part of a global organization that has a sister or company that is the American Cancer Society Cancer Action Network, that is our advocacy arm. So recently, this last year, there was a webinar, and they have our back. They are helping us from Washington, D.C. to make sure the territories, Puerto Rico and U.S. Virgin Islands, have the funding needed to cover their Medicaid. And recently we had a very important webinar that Justa Encarnacion, Tina Comisión from the Cancer Center, the Health Commissioner, patients were there telling us how important with their testimonial of having the funding needed to cover their Medicaid. So I just want you to know that the American Cancer Society is also working together to make sure that the funding of the Medicaid at the federal level is as needed so we could continue to provide the services in the island. The health system would collapse if we don't have that taken care of. So we also want to know that American Cancer Society is partnering with you and the USVI to help that continue to happen.
Excellent, excellent. Now we have just a couple of minutes left. So Dr. Cintron, tell our audience, how can they contact your office to set up an appointment to have a colonoscopy done?
Well, the phone number is 719-6300, 719-6300, or I have a website which is Dr. Cintron Gastro, drcintrongastro.com, and they actually can log in through the internet, and they can do their, because it's important, as I mentioned before, if I'm going to do a colonoscopy on you, I want to do it I want to be sure we don't offer any risks. So based on the information you put in the record, we might need to see you first before we do the colonoscopy in order to monitor, for example, anticoagulation, so you don't have any bleeding risk. So we need to have expertise from other specialists. But for the vast majority, if the patient has minimal comorbidities and problems, then we'll go ahead and schedule it. So I encourage, and again, these patients have to be taking care of their own health and they be advocates. So if for some reason you know that it hasn't been referred, then you don't need that. You just have to have the age. And I want to thank also Lillian and the Cancer Society, because moving this from 50 to 45 years was a big struggle. And unfortunately, it cost many lives. I'll tell you why. It has gone from we noticing that, hey, we're seeing a lot of people less than 50 that have cancer. But from that happening to us analyzing all the data, and depending on the area, it was from 5 to 9% patients. 9 patients out of the 100 were less than 50. That's a big number. And unfortunately, for all the government agencies, you need to talk about statistics. And while you're compiling the statistics, every statistics is a cancer patient. So they were able to push it, and we have to be thankful.
Excellent. Well, we're out of time. So you've been listening to Troy Deshabert-Schuster, State Director of AARP in the Virgin Islands, in conversation with Dr. Lillian Santos, the Executive Vice President of the American Cancer Society in Puerto Rico, and Dr. Raymond Cintron, gastroenterologist in St. Croix. We hope that all of you will take advantage of this wonderful service and contact Dr. Cintron to have a colonoscopy done so you can have early detection and even prevention of colorectal cancer. Thank you for joining us.
Thank you.
Thank you.